Okay guys. So sa previous videos nag-send ako sa inyo the adult approach and the child approach. So nakita niyo dito ang kaibahan. But ang kaibahan dito is gamay lang, basta leveling lang. But this time the latest cure of the conscious infant choking. So sa conscious infant choking naman, ang kaibahan niya is ang katong ginahimo sa infant is nagahatag tag 5 back blows and 5 chest thrust. So then ang baby is dili mo nakawala mga istorya. How we notice nga ang baby natukan na siya. Okay? Nauna, so makita to ang baby murag na siya more in a shock mood or the baby is crying. And mapansin po nato that the baby is in cyanosis, na bluish na lagom. So na mga signs nga makita nato nga baka ang bata is natukan or choking baby. So this atong tanawon ang video. Let's watch this video and practice after. Okay?
So now let's take a look at the conscious infant choking patient. There's a few things that should tip us off that the baby is fully conscious but also fully choking. And that is that their eyes are open, they may be gagging, they're still moving around, but they're not breathing, they're not coughing, and they're certainly not even able to babble, or if they're able to speak, they're not saying any words. You may even start to see this thing called circummoral cyanosis. That's a blue ring that starts to form around the lips of the baby, indicating that they're beginning to starve of oxygen, and our treatment is really necessary. If you have a bystander nearby, it wouldn't be a bad idea, and it would certainly be in the best interest of the baby, if you had them call 911 and get the ambulance on the way. If you didn't have anybody around, you could certainly call 911, but I still think it's in the best interest of the baby for you to begin doing the treatment first and wait until the baby goes unconscious if it's up to you to have to call 911. So what we're going to do is we're going to remove this onesie so that I can really show you the landmarks that are important as we begin to demonstrate the skill related to getting this obstruction clear. I'm going to place my thumb and forefinger over the cheekbones of the baby's face, supporting the head and neck, letting them rest on my forearm while they straddle my bicep. I'm now going to take the opposite palm and use that to give 5 back blows or back slaps between the shoulder blades of the baby. It's important to remember that the head of the baby is down while the feet are higher than the head. That allows gravity to work with us, not against us. 5 back blows. 1, 2, 3, 4, 5. Sandwich the baby's head and neck to support the neck and head. Ring finger across the nipple line, 2 fingers down on the chest, on the sternum. And now we're going to repeat with 5 chest thrusts. 1, 2, 3, 4, 5. If the baby did not get rid of the obstruction, and indicating that with breathing again, coughing, gagging, starting to try to cry, we're simply going to repeat the process. We're going to sandwich thumb and forefinger over the cheekbones, flip the baby back over, face down, straddling our bicep, and repeat with 5 back blows. 1, 2, 3, 4, 5. Turn the baby over, ring finger across the nipple line, 5 more chest thrusts. 1, 2, 3, 4, 5. We're going to continue to do these back blows and chest thrusts until the object comes out, the baby begins to breathe again, or the baby goes unconscious. If the baby goes unconscious, it's at this time that if we haven't done it already, we call 911 and get an ambulance on the way. If the baby does go unconscious, we then move into the unconscious infant choking procedure. But it's important to note that when we're doing the back blows and the chest thrusts, make sure we don't let our arms sag with each of those compressions or back blows, as when it sinks down, it diminishes the effect of the actual chest thrusts that are forcing the air up the trachea to pop that object out. Keep in mind that this is about 80% effective when you do the chest thrust and the back blows. It's an extremely effective procedure, and it can work really well if you run into this type of situation.
Okay. So, sa pedia, sa infant, rather, sa infant demonstration, emphasize dito how to 5 back blows and 5 chest thrust. Okay. Position the back. So ang one leg ng baby i-lock natin sa ang bicep. Then between two shoulder blades sa baby, so do ito magamit sa tuwang opposite hand na to. So 5 lang, 5 back blow or slap. 1, 2, 3, 4, 5. And reverse to the other arm. Forearm nimo is ang imuhang ring finger is na naka cross level ng nipple line sa baby because or dyan ito ang 2 fingers position. So position 2 fingers, then 5, give 5 chest thrust. 1, 2, 3, 4, 5. Okay. So continue procedure as long as no signs na nagustuhan siyang ang object and there's no signs of crying. Okay, na walay recovery ang baby. Continue lang ang process. Okay, if you have some questions, you can ask questions and then to me. I will try my best to answer your questions, guys. Okay, daw.